Hello, I'm Dr. Michael Fossel, and I'm going to talk to you a little bit about something remarkable that's going on with regard to technology and specifically biology. Most of us, I think, are technophiles. We're fascinated by technology. But I find that as I look back and ask myself what really allowed us to have technological advances, it almost invariably boils down to conceptual revolutions, that is, understanding what's really going on with our universe. For example, I think many human beings thousands of years ago assumed the world was flat. It was perfectly rational when you looked around you, it looked flat, but the assumption was wrong. In the same sense, we thought that since the sun came up and went down, obviously the sun's going around the earth, which again was wrong. And there are many assumptions we make like that. And it's only when we re-examine those assumptions and step back that we can make progress forward. For example, the Copernican revolution I've mentioned, the scientific revolution, for example, Newton's Principia, microbial theory, which we'll come back to, which allowed us to understand really what's going on with a number of diseases and cure them. And quantum theory, which took us from the idea that everything was just a matter of small billiard balls and even smaller billiard balls to understanding something of the quantum nature of the universe, which allowed us to have conversations like the one we're having right now on Zoom, to have cell phones, to have global positioning satellites, to have many of the things that we take for granted these days. So technology really depends on our ability to understand our assumptions and re-examine them and make progress because we understand more about the universe. Well, the same is true with regard to aging. Most people have tended to assume, as I discovered when I was getting my degrees on this campus almost 50 years ago, that aging just happens. Aging is just one of those things that you get older, things fall apart, what do you expect? That sort of blasé attitude was very typical for many of the concepts, the assumptions we've made throughout human history. As I say, flat Earth, the Earth as the center of the universe, the idea that matter was composed of little teeny billiard balls, or for that matter, that diseases were caused by evil spirits and the curse of God. There's obviously more to it than that, and there was more to it than aging too. I find that aging is much more complicated than we give it credit for, and people never realize the assumptions that they're making about aging. As a result, we can't make much technological progress, but we're about to. I first gave a talk about this topic at this is the National Institutes of Health in Bethesda, Maryland, 25 years ago this year. And what I first said was that anyone who thinks you can reverse aging or can't reverse aging is naive. The question is, what's the data? And then I talked about the concept of aging itself, what really is going on with regard to aging, and trying to get a better grasp on not only our assumptions, but on the truth that's operating at a fundamental level in the cells and genes. And the outcome of that was that I wrote the first book ever in human history on reversing human aging, followed by the first articles in the medical literature, in this case, 2 articles in the Journal of American Medical Association, about the prospects for understanding the aging process at the cellular and genetic level as a way of being able to prevent and cure age-related diseases and the potential for doing that. This was followed by the first and still the only medical textbook in this area with Oxford University Press, where I looked at each and every organ system and tissue in the human body and at age-related diseases and asked myself, what's going on at the cellular and genetic levels that leads to these clinical diseases, and what can we do about it? And finally, this book here on the far right, which was a book for the general public in the Wall Street Journal, called one of the best science books of the year. But that question still remains, which is, how does aging work and what can we do about it? Well, to date, we have done nothing about it. The human lifespan has increased, that is the mean human lifespan, from about a quarter of a century to a half century to now 3/4 of a century, but without any impact on the aging process itself. What we've done is basically treated and cured and prevented a number of diseases that are not aging related, but we've done nothing about the aging process. So for example, the estimated maximum human lifespan is about 120 years, and that has not changed, as far as we know, throughout all of both recorded and history and prehistory, the human race. So speaking of improving human lives though, what really has made a difference in improving the quality of human life? Not simply the length of it, but the quality. And the answer is another conceptual revolution, and that is microbial theory. It allowed us to actually begin to intervene in things we couldn't before. So for example, the first smallpox vaccines, the advent of hand washing during deliveries of babies drastically cut both the maternal and the neonatal death rates. Sterile surgeries, the first rabies vaccine with Louis Pasteur, the first penicillin, the first antibiotics in general, polio vaccine, for example. Now, what's interesting about microbial theory and the technological advances we've made for this is not only have these advances enormously improved the quality of human life, but they've actually lowered, not raised, but lowered the cost of medical care. That is true globally, nationally, and personally. So, for example, in 1950, a number of countries in this world were concerned about the cost of treating polio, particularly iron lungs. And the same was true of rehabilitation and braces and a number of other so-called interventions. And the estimates were that these countries would be medically bankrupt by the year 2000. Well, because of the Salk vaccine, by the year 2000, the cost of preventing polio was a little less than 10 cents per patient. So rather than purely technical advances, that is, can we create a better iron lung, what we did was we made a more fundamental advance, which was to cure and prevent polio. Well, the same thing is about to occur in another historical first, which is not only microbial theory and its effect on improving lives, but our ability to understand aging, age-related diseases, and more importantly, to intervene, that is, prevent and cure age-related diseases. Now, the first demonstration that we could actually reverse aging in cells, and I'll give you the details on this in a minute, was made 23 years ago with human cells in the laboratory. 21 years ago, the same thing was done with human tissues, and I'll show you that data as well, followed by mice now 10 years ago and 9 years ago, and we'll look at that. And we're about to progress to a dog study a little later on this year, and then take this to FDA human trials to show that we can intervene in the most fundamental processes of aging at the cellular and genetic levels. Well, let me introduce you to a friend of mine who sort of, in a sense, started all this. This is Dr. Leonard Hayflick. He first described cellular aging in 1961. He and I talk fairly regularly. In fact, I just got an email from him this morning. He's doing very well, thank you. But he made this remark to me when we were chatting about a year ago, and he is right. All of us would agree that aging itself is the single most predictive risk factor for age-related disease. But then people, almost without any exception, ignore the aging process and focus on signs, symptoms, biomarkers, hallmarks, outcomes of aging rather than the disease process itself. They look at the histology, the pathology, but not the underlying disease process. Well, what can we do about that? About 2 years ago, the Alzheimer's Association invited me to Washington to help organize a conference on animal models. In this case, we were dealing with age-related diseases and specifically Alzheimer's disease. Now, the problem, as many of you know, is this quote here: everything works in mice, but nothing works in humans. And in fact, not everything works in mice. But the problem is you have a model, for example, of Alzheimer's that you can do something about in mice, but it doesn't work in translational studies when you take this to clinical trials. The question is why? So I summed up the first day by pointing out that there were important technical problems having to do with non-shared genes between mice and humans, but there was a much deeper problem conceptually, which is while we had techniques like monoclonal antibodies, and we have targets like beta amyloid, tau tangles, mitochondrial dysfunction, microglial activation, and so on, what we lack utterly is a unified systems model to explain how these diseases actually work and what it has to do with aging. Well, as a result of that talk, I was mobbed by people who complimented me, but one person said, you didn't describe a model. You said we need a model and what the model should look like. Do you have such a model? And I confessed I did. I just didn't want to impose that on everybody. He asked if I would write it up, and we talked for a while. He turned out to be the editor-in-chief of Alzheimer's and Dementia, the world's most prestigious Alzheimer's journal or dementia journal. And he then was so impressed that he recused himself from the editorial process and joined our scientific advisory board. Now, the paper went through 8 editorial reviews, complimentary, asking me to expand the paper, which I did. And it came out about a year ago, promptly got more than 600 global reprint requests, and also invitations to speak, such as this one. But the gist of that article was not only that we had a unified systems model that was consistent with all known data, and it was predictively valid, but it offered a novel point of intervention for us to try to clinically intervene in the Alzheimer's process. Let me explain what I mean by unified in the systems model. By unified model, I mean any model needs to be able to explain the differences between different patients with any particular dementia. So for example, some Alzheimer's patients get Alzheimer's early and some late in life. Some have some motor deficits, some don't. The same is true of Parkinson's. Some have some cognitive deficits, some don't. And again, it varies with age and so forth. So we need to understand that heterogeneity within any dementia, also between dementias. Why is it that somebody gets frontotemporal dementia, somebody else gets Lewy body, somebody gets vascular, somebody gets Parkinson's, and why are there overlaps between these different dementias? Also between species. We know that cognitive decline with age occurs in almost all species we study, but it occurs in different ways. different pathologies, different cognitive problems. Why does that happen in different species? Can we explain that? Also, upstream mechanisms. For example, we know that a history of head trauma increases your risk of Parkinson's and Alzheimer's, but why is that? We know that exposure to some toxins, for example, dioxin and a number of others, paraquat, can increase your risk for some of the dementias. But why is that? We know that certain genes, for example, the ApoE4 alleles, are linked to an increased risk of Alzheimer's. Why is that? How does it get expressed? Likewise, if you have hypertension and hyperglycemia, you'll tend to have an increased risk. But why is that? How does it actually occur? What's the process? Likewise, downstream biomarkers. We know that many patients will have tau tangles, and many Parkinson's patients will have alpha-synuclein aggregates. Why? And why is it that beta amyloid is found more in certain patients than others? Why does that occur? Can we come up with a model that is a unified approach to try to explain all of these things, and also a systems model? By that, I mean a model that doesn't simply look at components, but looks at the dynamic process that underlies those components. So let me give you an example from engineering. This is the cockpit of an Airbus 380. At the upper right, you're looking at a Pearl 15 jet engine, which is powered by the Trent 900 turbofan at the lower right, including that one turbofan blade. But flying an Airbus 380 at 35,000 feet at hundreds of miles an hour with that Pearl 15 jet engine going at a very high RPM and high temperature is more than a collection of components. You can't simply lay down the components in front of you and explain how all of this works. You have to explain the process by which they work together as a unified whole. So you need a systems approach that explains the dynamic process between all these parts as they are functioning. The same is true with regard to medical problems. For example, this is an image of COVID. These are signs and symptoms of COVID, but note that that's not the same as saying that these symptoms and signs are COVID. They're simply outcomes, they're signs and symptoms, they're biomarkers, they're components, clinical components in a sense of COVID, but they're not the disease itself. The disease itself is the dynamic, complicated process between the coronavirus and the human immune system and the rest of our bodies. So to understand the symptoms and signs of COVID not only is not enough, it's certainly not enough to allow you to cure it. You need to understand what's going on at a more fundamental level. And the same is true of aging. These are so-called hallmarks, 9 hallmarks of aging that are put out by an organization that's somewhat known globally. But the problem is these are clickbait. These are no more than signs and symptoms of aging, but they in no way demonstrate how aging works. They essentially have nothing to do with it. They're simply downstream outcomes of aging. They are not aging itself. Nobody has put these together and asked, can you come up with a unified systems model that explains how these things work? Now, the same thing is true clinically if we look at aging too. These are common biomarkers of aging at the clinical level that we see in our patients, or for that matter, in the mirror or in our friends in public. But none of these are aging. If I have a declining glomerular filtration rate, that it may be part of aging for many people, but it doesn't explain why it occurs. The same is true of all of these other things. Why do we get memory loss? Why does hair turn gray and so forth? The same is true if we look down at microscopic levels. We can look at all of these things that occur, but telomere shortening, acetylation changes, methylation changes, changes in epigenetic expression, declining ATP to reactive oxygen species ratios. None of these things are aging. They're components of aging. They're biomarkers. They're things we can measure, but they're not the process itself. If we really want to be able to intervene in age-related diseases, we need to understand how the aging process works completely, and again, at a systems level. The same is true of the dementias in particular. These are common findings. We've known about beta amyloid plaque for more than 110 years. Tau tangles we've known about for decades and decades. Many of these things, the blood-brain barrier failure, glymphatic changes, a relatively recent observation, but none of these are dementias. They are biomarkers found in many dementias, not all, and they may help serve to explain what's going on, but they don't serve as an underlying fundamental explanation of how these dementias work in age-related disease. And the same is true if we look at the genetics. Knowing that if you have 2 ApoE4 alleles, you have a much higher risk of Alzheimer's does not explain Alzheimer's. Furthermore, we know that some people with 2 ApoE4 alleles don't get Alzheimer's, and some people without those 2 alleles do. So why is that? We know more than 200 genes that are related in one way or another to some of these dementias. But in no case is that an explanation of the disease. They're simply components of the disease, not an explanation, certainly not a systems explanation of it. So unless we truly understand the underlying aging process, how can we possibly understand age-related diseases? And more importantly, how can we cure them? So let's take a better look at aging itself. These are a number of species that I think most of us are aware of. Human beings live, for example, an average of about 75 years currently. That's gorilla. That's Coco in the upper left. I was her babysitter at Stanford campus decades ago for a year, every Wednesday for 6 hours. Remarkable experience. She lived about 40 years, as many gorillas may. Typical domestic animals like dogs and cats may live 15 or 20 years, depending on the breed you're looking at. If we're looking at laboratory rodents, you're typically looking at 2 or 3 years for a lifespan of a laboratory rodent. Well, why do they have different lifespans? You could say that it's entropy, but that's obviously not true because it's more than just that, because why would entropy work at different rates in different species? You would then say, well, there are genetic differences and epigenetic differences as well. But that's not an explanation. Yes, we have different genes, but how do those parlay themselves into different lifespans, into different rates of aging? What is going on between genes and the aging process itself? The same is true when we look within the species. For example, progeric human children. I used to gather them all together from around the world about 2 decades ago. And this particular year, I was gathering with Bill Sample in the back with his hands raised, and I, in front of the North Portico of the White House, we had just given a tour of the White House to these some 30 children. These children die overwhelmingly of age-related disease. Typically, they die of cardiovascular disease. For example, all of the children you've seen here are now dead of strokes and heart attacks. These children also have osteoporosis, osteoarthritis. They are bald. They have poor skin healing. That's typical of these children. But why? Well, we know that these children share, in general, a lamin A gene. But note that, again, that is not an explanation. That's a finding, but it doesn't explain the systems process that takes you from a lamin A gene to early aging. So we also have examples of cells and cellular cell organelles that don't age. For example, every cell in your body derives from a fertilized ovum, most of which you got from your mother. And that line of germ cell lines goes back about 4.5 billion years. And during the initial 4.5 billion years, that cell line never aged at all. And yet, in a matter of decades, there's a stiff inflection point, and your somatic cells begin to age. Now, many people would ascribe aging to mitochondrial changes. But the mitochondria, everyone in your body derives from your mother, who got it from her mother, and that line goes back in the eukaryotic lineage for about 1.7 plus billion years, and it never aged. Why does it show aging in a matter of decades in you and yet didn't for billions of years? Likewise, the somatic cells in general. We'll look at that exactly in a minute. Well, it's clearly not just entropy, it's a matter of entropy versus maintenance. And if we look, for example, at a typical germ cell line, what you find is that maintenance is flawless. It doesn't mean that cells don't die or get damaged, but they don't age. And the reason is they maintain themselves in the face of entropy. Whereas if I look at the somatic cells of this, the 80-year-old man in the wheelchair at the left there, if I look at any of the somatic cells in his body, in this case, if I'm looking at the keratinocytes, the fibroblasts, the endothelial cells in his vessels, the macrophages, any of the cells I'm looking at show age-related somatic changes that are manifested by a decrease in maintenance. So it is not simply a matter of entropy, it's a failure of maintenance. In fact, this brings up kind of a general concept that goes on in biology, and that is red queen theory. Red queen theory in biology is usually applied to the competition between prey and predators in a sense. So for example, the human immune system is constantly battling against the evolutionary changes that occur in, for example, microbes. So every time a virus gets a little better, we hope our immune system gets a little better. It's a continual battle to stay in one place. So to quote Alice in Wonderland from Lewis Carroll, it takes all the running you can do to keep in the same place. But the same is true with regard to cell maintenance. We are continually running a race against entropy. And that race is keeping us continually in one place, that is maintaining cell integrity in the germ cell line, but not quite in your somatic cells as we get older. And the question really is why? Well, the answer turns out to involve a lot of things, among them telomere shortening, epigenetic changes, and this particular occurrence, which is molecular turnover changes. If I look at any molecule in my body, with the exception of my chromosomes, the DNA, what you find is it's continually being recycled. It is actively being turned over. So for example, whether I'm looking at the collagen and elastin in my skin, the beta amyloid around my microglia and neurons in my brain, or whether I'm looking at some of the aerobic enzymes, for example, in my mitochondria, they're continually being turned over. And the outcome is that when they get damaged, and they do, signified here by the little red star, the damage is washed out. You're continually making molecules, some of them can be damaged, but you replace them with new molecules. So in a young cell, the outcome is you maintain yourself in the face of entropy. But as your telomeres shorten and gene expression changes, molecular turnover slows down as well. So the outcome is As that turnover slows down, entropy begins to take sway, and you end up with a bit more in the way of damaged molecules. And this becomes even more so as the cell gets older and turnover slows down. So at equilibrium in any of those cells, the percentage of damaged molecules go up, so the cell becomes less functional, and you begin to get age-related diseases. In fact, you can look at it mathematically. This is taken from my textbook. But what it says in essence, in young cells with a high rate of turnover, the accumulated damage at equilibrium is very small, whereas in older cells, as that turnover slows, the accumulated rate of damage goes up, and the result is dysfunctional cells and pathology. We can look at a particular case of that. For example, in the central nervous system, we could look at just beta amyloid. We'll restrict ourselves to just beta amyloid for a minute. And what you find is that beta amyloid is also being turned over in young cells. So for example, if we're looking at microglia in the brain, we can actually measure the rate of turnover. So beta amyloid is being produced, secreted, rebound, internalized into the cell, degraded, produced again, and it's a continual recycling process. So at any given time, the dysfunctional molecules, the denatured molecules outside the cell, the beta amyloid molecules, are few. But as you get older, that rate of turnover slows down, and the outcome is that you get more and more damaged molecules that begin to cross-link and form beta amyloid microaggregates. Now, if you are lucky and you have two ApoE2 genes, you tend to make molecules that aren't very sticky. So the rate of damage is low, and you are less likely to accumulate beta amyloid microaggregates as you get older. So your incidence and your onset of Alzheimer's tends to be much easier, much more positive. But if you have two ApoE4 alleles, you tend to make stickier beta amyloid molecules. So the outcome is you make more in the way of damage. You have more beta amyloid damage. And so at any given rate of turnover, you have more in the way of beta amyloid microaggregates. And in any case, as we get older and that rate slows down, you're more and more prone to beta amyloid, not only microaggregates, but actual plaques. Now, the same as it turns out is true not only for beta amyloid, but other molecules, whether you're looking at tau tangles or the molecules that function in mitochondria or that cause cellular inflammation changes. All of these show the same related slowing of turnover as we get older. And the outcome of that is loss of synapses, cell dysfunction, loss of cells, and frank clinical dementia, which we see clinically. So what about the mitochondria, though, to take us back to those? Well, it turns out that 99% of the molecules that function in mitochondria derive from the nucleus, where you see this slowing of recycling. And the outcome is the mitochondria becomes less and less functional. And in fact, it's harder and harder for the mitochondria to make ATP and easier to make reactive oxygen species, that is free radicals. But not only do you make more free radicals as the mitochondria shows age-related changes because of the nuclear changes, but the lipid membranes also are being turned over more slowly. So they get more damage and become leakier. And the scavenger molecules, for example, catalase and superoxide dismutase, are also being turned over more slowly, so they're less effective. And the damage that occurs in other molecular pools is being turned over more slowly. So there's an exponential rate of increase in dysfunctional molecules throughout the cell. And of course, some of these free radicals go through other leaky membranes, which are the nucleus, and they have an impact on our DNA. Now, your chromosomes, your DNA, are the only molecules you actually repair as opposed to simply recycle. So you're continually detecting, excising, replacing, and ligating into place all of these DNA bases. So while we've been talking, there's been DNA damage probably in every cell in your body, but you have almost flawlessly replaced it. However, the rate of turnover of those detection molecules, excision molecules, replacement molecules, and ligation molecules is slower as we get older because of changes in the nucleus and the telomeres. So the outcome is an exponential increase in your rate of DNA damage, and therefore, over a lifespan of almost any species, an exponential increase in cancer. But while it's true that telomeres shorten, I don't mean to mislead you about what telomeres do and don't. Telomeres don't cause aging. There is nothing that causes aging. The concept is sort of naive. It's too complex to fit into a single sentence. Furthermore, telomeres no more cause aging than genes cause evolution. In both cases, they're key players. You couldn't really have a discussion about evolution without involving genes, but genes aren't the cause of it. They're just a key role in evolution. Telomeres likewise. They don't cause aging, but they play a key role in how aging works within the cell. And telomere length doesn't matter. The change in length matters. Absolute length is irrelevant. And it turns out you can look at the rate of telomere loss and predict the species lifespan. But the length itself doesn't matter. So for example, there are some varieties of mice that have telomeres at birth that are 10 times mine, and yet they have lifespans 40 times shorter than mine. And the reason is they lose telomeres faster, therefore they change the rate of gene expression faster, and therefore molecular turnover slows faster, and therefore they get older and older cells faster than I do. So it's not telomere length, it's the change in length, and more importantly, the effect it has on gene expression and cell function. Well, this is sort of an overall model you might look at. We've got a number of upstream factors, and I've listed a dozen or so at the left, that have an impact on cell aging. For example, again, toxins. We know that toxins can increase cell damage, which increases turnover, which shortens telomeres, alters gene expression, and the result is age-related disease. Hypertension and hyperglycemia do that, particularly for vascular endothelial cells and subendothelial cells. Trauma, likewise, head trauma. Genetic risk, as I mentioned before, aging itself. All of these have an impact on our rate of cell aging. Now, we also have downstream factors, for example, beta amyloid, tau tangles, and others, dozens of others. And when we try to intervene, what we find is that upstream factors work to some extent. For example, if I can normalize your hypertension and make you euglycemic, you have a lower risk of vascular disease and vascular dementias, but not a zero risk, let alone can I reverse it. The same is true of downstream factors. If we try to get a handle on any of these things, we find that they're not an efficient point of intervention. The most effective single point of intervention, optimal point of intervention clinically and financially, turns out to be telomeres and cell aging. And the reason we know that is because it works. The first case in which we've ever shown reversal of cell aging in human cells was now in this 1998 article by Andrea Bodnar and her group out at Jaron in California. And what they showed is that when you take old human cells that use telomerase, you can reset the pattern of gene expression to that typical of a young cell. In short, you can reverse aging in human cells at will. What about tissues? First time that was done by Walter Funk and his group also at Jaron, now 21 years ago. And what they did was took old human skin cells and showed that you could grow young human skin by, again, telomerizing those cells. And in fact, the same is true of bone cells, and the same is true of vascular endothelial cells. So we've been able to show we could reverse aging in human cells and human tissues. Can we do that in an organism? Well, the first time that was partially accomplished was by Rhonda Pino's group at Harvard, now 10 years ago, followed by this article out by Maria Blasco and her group in Madrid at CNIO 9 years ago. And what this showed is, again, if you look at older mice, you can actually reverse the aging process in almost any of the parameters you want to look at, including lifespan, physiologic changes, and behavioral changes in these mice by using telomerase. So the question is, what happens when we take this to human trials? And the answer is, that's exactly what we're going to do. We're going to restore normal young cell function to aging cells. By using telomerase therapy, our first target will be Alzheimer's, but this is a platform technology. Our focus is going to be on the safety, the efficacy, and the credibility of doing this. We want to do it very carefully. It's remarkably difficult technically to get this right, but that's what we intend to do. Now, since this is technology universe, and many of you are aware of Star Wars, for example, and The Mandalorian, let me put this in Star Wars terms, which is to say, this is the way. This is the way I think we can demonstrate that we can cure and prevent age-related diseases, do it effectively, and demonstrate that clinically within the next few years. Thank you very much for joining us. I look forward to talking with any of you who want to get in touch with me, and good luck to you all.